Navigating Medicare can feel a bit complex, especially when you encounter terms like Medicare Advantage. If you've been wondering what Medicare Advantage is, how it works, and if it might be the right choice for your healthcare needs, you're in the right place. Today we're going to break down Medicare Advantage in a clear and understandable way. Let's start with the basics. Medicare Advantage, also known as Medicare Part C, is an alternative way to receive your Medicare benefits. Instead of getting your coverage directly through Original Medicare, which is Part A for hospital insurance and Part B for medical insurance, you choose a health plan offered by a private company approved by Medicare. Think of it as an all-in-one bundled plan. These plans are required to cover everything that Original Medicare Part A and Part B cover. When you choose a Medicare Advantage plan, Medicare pays a fixed amount of money each month to the private insurance company you select. In return, that company manages your healthcare coverage. Here are some key aspects of how it typically works. Many Medicare Advantage plans use provider networks. This means you may need to use doctors, hospitals, and other healthcare providers who are part of the plan's network, especially for non-emergency care. Going out of network could result in higher costs or, sometimes no coverage at all. Some plans, like health maintenance organizations, or HMOs, may require you to get a referral from your primary care doctor to see specialists. Preferred Provider Organization, or PPO, plans often offer more flexibility but may charge more for out-of-network services. You'll continue to pay your Medicare Part B premium to Medicare. In addition, many Medicare Advantage plans have their own separate monthly premium, though some plans have a $0 premium. You'll also have co-payments, co-insurance, and deductibles, which can vary significantly between plans. A significant benefit of Medicare Advantage plans is that they include a yearly limit on your out-of-pocket costs for Medicare-covered services. Once you reach this limit, the plan pays 100% of your covered healthcare costs for the rest of the year. Original Medicare does not have an out-of-pocket maximum. As mentioned, Medicare Advantage plans must cover all medically necessary services that Original Medicare Part A and Part B cover, including emergency and urgent care. But here's where they often differ, and can be quite appealing. Most Medicare Advantage plans include prescription drug coverage, bundling your medical and drug benefits into one plan. This means you typically don't need to purchase a separate Part D plan. Many plans offer additional benefits that Original Medicare does not. These can include routine dental care like cleanings and x-rays, routine vision care such as eye exams and eyeglasses, routine hearing care like hearing exams and hearing aids, fitness programs like gym memberships or wellness programs, over-the-counter allowances, transportation to medical appointments, and telehealth services. To be eligible for Medicare Advantage, you must be enrolled in both Medicare Part A, which is hospital insurance, and Medicare Part B, which is medical insurance. You also need to live in the service area of the Medicare Advantage plan you want to join. Understanding when you can enroll or switch plans is crucial. The initial enrollment period is your first chance to sign up for Medicare. It's a 7-month period that begins 3 months before you turn 65, includes the month you turn 65, and ends 3 months after you turn 65. If you're eligible due to disability, it's also a 7-month period around your 25th month of receiving disability benefits. The annual enrollment period, also known as the Fall Open Enrollment, runs from October 15th to December 7th each year. During this time, you can switch from Original Medicare to a Medicare Advantage plan, switch from a Medicare Advantage plan back to Original Medicare, switch from one Medicare Advantage plan to another, or join, switch, or drop a Medicare prescription drug plan. So, which is better, Medicare Advantage or Original Medicare? Well, there's really no single best answer here, since it all depends on your individual needs, your preferences, and of course, your health situation. Here are some key differences to consider. First, coverage. Original Medicare covers hospital, that's Part A, and medical services, that's Part B. Medicare Advantage plans, on the other hand, include both Part A and B coverage, usually Part D for prescription drugs, and often offer some extra benefits too. Next up, provider choice. With Original Medicare, You can typically go to any doctor or hospital that accepts Medicare. But with Medicare Advantage plans, you're often limited to a plan's network of providers. Now let's talk about costs. Original Medicare has deductibles and co-insurance, but there's no annual out-of-pocket maximum. Medicare Advantage plans may have premiums, some are even $0, plus co-pays and deductibles, but they also have a yearly limit on your out-of-pocket costs for covered services. And for prescription drugs, with Original Medicare, you usually need to purchase a separate Part D plan for prescription drug coverage. Most Medicare Advantage plans actually include prescription drug coverage. To decide if Medicare Advantage is a good fit, consider these questions. Do you prefer having all your coverage bundled into one plan? Are you comfortable with potential network restrictions? Do you value extra benefits like dental? Do you value extra benefits like vision? Do you value extra benefits like fitness programs? Do you want an annual limit on your out-of-pocket costs? And are there plans in your area that meet your specific healthcare needs and budget? It's highly recommended to compare plans available in your specific area, since benefits, costs, and networks can really vary widely. Medicare Advantage offers a different way to receive your Medicare benefits, providing a wide array of options and often extra benefits not found in Original Medicare. Understanding the structure, costs, and features of these plans is key to making an informed decision about your healthcare coverage. Thank you for watching. If this information helped clarify Medicare Advantage for you, please share it with others. Stay informed and make the best choice for your health.